Hey everyone, welcome to our live stream with Dr. Waits and Ashley Middlebrooks. My name is Danielle Gomez. I'm a Community Development Coordinator here at Cahaba Medical Care. If you don't know us, we're Cahaba Medical Care, the home for all your healthcare needs. And we do primary care, regardless of your insurance status, regardless of how much money you have, we're going to take care of you. We're located across central Alabama. We now have 21 locations as far south as Camden, Alabama, and several locations around Birmingham. Today we're going to be talking about colorectal cancer screening. So what is colorectal cancer? Why do I need to think about it? And how can I prevent it? So I'm here today with Dr. Waits, who is Cahaba Medical Care's very own CEO, taking time today to answer your questions about colorectal cancer screening. And he's a family physician. He does endoscopy, colonoscopy. He's been doing colorectal cancer screening for over 2 decades now. So he's a real expert and is here to answer any of your questions at any point during our live stream. Please just comment your questions below and we'll make sure to get it answered. I'm here with Ashley Middlebrooks, RN, as well. She's a nurse here at Cahaba that has been doing endoscopy for 10 years now. And they're both just really great resources for you to learn on Facebook what you need to think about colorectal cancer screening. So just today we're going to be talking about what is colorectal cancer screening, who needs to be thinking about it, what are my options, how can I prepare for screening, and yeah, so let's go ahead and get started. So Dr. Waits, first of all, what is colorectal cancer?
Well, first, let me start with the cancer part. So cancer is an abnormal growth of cells. Basically, the cells divide and something happens where they continue to divide. What a lot of people don't recognize is that the cancers in different parts of the body behave very differently, almost like different diseases. Cancer of the colon is your large intestine. It's the 3rd most common cancer in men and women in the United States. So the cells of the lining of the colon kind of grow out of control and form a polyp, or worse, a tumor. And if they just really get out of control, it becomes a cancer.
Thanks, Dr. Waits. Ashley, can you tell us a little bit about what the symptoms of colorectal cancer might be?
Yes, some of the symptoms is blood in your stool, a change in your bowel habits, any abdominal pain or cramps that do not go away, and unexplained weight loss.
Yeah, so if you feel like you've been experiencing any of these symptoms, it might be time to give us a call at your local health center. You can visit cahabamedicalcare.com/locations to find the location closest to you. We'll make sure to get you in, just have a conversation with your provider about what some good screening options might be for you. Dr. Waits, next question is, who can get colorectal cancer? Who is at risk for it?
Well, first risk is being an American. So it is a common cancer in the United States of America. The risk of colon cancer, it increases as we get older. If you have a family history of colon cancer, father, mother, sister, brother, that's a real risk, especially if they got it younger in their life. There are some other diseases some people may not have heard of unless they've heard of it, in Crohn's disease, ulcerative colitis. There are other familial syndromes that can really make colon cancer more likely. And then there's lifestyle habits. It really is true that just some of the basics that everyone will be familiar with, that a lack of physical activity, a poor diet, one that's heavier in red meats and lower in fruits and vegetables, eating a lot of processed meats makes it a little more likely. And the heavier that we get and the more alcohol or tobacco that you use makes many types of cancer, most types of cancer that I'm aware of, is a huge risk factor.
Yeah, thanks, Dr. Waits. So again, lifestyle is very important, even with preventing colorectal cancer, making sure you're eating well and getting enough exercise. Again, great opportunity to talk to your provider at Cahaba Medical Care. You can visit our website to find the location closest to you. The next question we have for our viewers is, Ashley, what is a polyp and what does it have to do with colorectal cancer screening?
A polyp is a abnormal growth of cells, and over an extended period of time, those cells can turn into cancer, which is why it's so important to get your routine screening so we can find those polyps and get them removed way before they have a chance to turn into cancer.
Yes, so again, it's very preventable if you're getting your screening done in time. Dr. Waits, next question is, can colorectal cancer be prevented?
That's right. So it is one of the most preventable cancers if caught early. One of the reasons it's very preventable is that the colon, if you think about it, it's a hollow tube. It's where your food passes through. It's where your stool is formed at the end of the digestive process. But at the time of a colonoscopy, we can look inside that tube and find those polyps growing. We can go on a polyp hunt, if you will, and remove those polyps before they ever turn into a cancer. It is because of the lack of screening being completed that colon cancer is the third leading cancer cause of death in the US. If everybody got colon cancer screening, colorectal cancer would barely register on the map, truly. Current data shows that almost 2,500 people in Alabama were newly diagnosed with colon cancer in the last year that we measured this. So it's a significant problem, and it's just so tragic that it's so preventable.
Yeah, so again, I just want everyone to make sure they hear that colorectal cancer is preventable. And one of the best ways you can prevent it is make sure you get screened on time. So our next question, Ashley, is what are the screening tests for colorectal cancer?
So here at Cahaba, we offer two types of screenings. We have the first one is the FIT test. Is where we give you a stool card, something you take home, and then you can bring it back to our office. We send it off to a lab, and that is checking for blood that's in your stool, and it's blood that you would not be able to see with the naked eye. So we send it off to a lab, and they look to see if there's any blood in there. The second is a colonoscopy, which we also do here at Cahaba. We do it at our Centerville location.
Thanks. So just again, we've got two options for colorectal cancer screening. We've got the FIT test, which is a stool test that you can get done at home. And the second test is going to be the colonoscopy. So talk to your provider about what is the best option for you. One of our options that we have is called e-visits. It's a telehealth service where you get to talk to your provider via FaceTime. So you can visit cahabamedicalcare.com/e-visit to schedule an appointment today. You don't even have to leave your house or your work or even your couch if you're ready to talk about colorectal cancer screening options. That would be a great opportunity for you to visit our e-visit website. Hey, Dr. Waits, why is screening for colorectal cancer important?
Well, it's so important because you want to catch a cancer before it turns into a cancer. You want to catch a polyp or a tumor before it turns into cancer. Not every cancer has that life cycle, and not every cancer in every part of the body can you detect it this early. It is much better to remove something pre-cancerous before the cancer happens than it is to do radiation and chemo and surgery and those sorts of things.
Yeah, so again, very important to look for those ways that you can prevent colorectal cancer, and screening is one of those ways. So you might be hearing this and you're like, okay, I can get a colonoscopy, I can get the FIT test. I understand it's very important, but do I need to get screened? So Ashley, can you tell us who should get screened?
Everyone should be screened starting at the age of 45.
Yes, so starting at age 45, you're going to want to get screened. That's men and women. And Ashley, is there an age that you'll stop getting screened after age 45?
Most people choose to stop screenings at the age of 75, but that is a discussion you should have with your physician.
All right, so men and women, generally from ages 45 to 75. And Ashley, is there anybody that is at maybe a higher risk for colorectal cancer that should get screened before age 45?
Yes, so anyone with a family history of colon cancer is at increased risk and should be screened sooner than 45. And there's also some conditions that Dr. Waits mentioned earlier that increase your risk as well. So definitely, if you're concerned and you think you have a family history, talk with your provider and see if you should be screened sooner.
Yeah, so once again, generally starting at age 45, you should start doing your colorectal cancer screenings. You can talk to your provider about that. And however, if you are at risk, if you have a family history, if your mom, dad, brother, sister was ever diagnosed with colorectal cancer, it's important to get screened before age 45 because you might be at higher risk for it. So again, just talk to your provider about it. Call your local health center, Cahaba Medical Care. You can find our locations at cahabamedicalcare.com/locations and give us a call, or you can use our e-visit service also available on our website. Dr. Waits, our next question is, we've heard that there's two different screening tests available, the FIT test and the colonoscopy, but which is the screening test that's best for me?
Well, both of these are great tests. That's the first important comment to make. The FIT test is the quickest and the easiest. The colonoscopy is more advanced, has a higher detection rate. Both of them save lives. So you should talk with your primary doctor to discuss your personal risk and decide which one is best for you. The FIT test, just so you know, has to be done every year. A colonoscopy is usually done every 5 to 10 years. It will be done more frequently if you have an increased risk or have had a history of colon polyps. Check with your doctor and your personal history.
Yeah, so again, your options are you can do it every year with the FIT test. Your colonoscopy is going to be on average every 10 years. And just talk to your provider about what the best screening test is for you. Ashley, another common question that we get about colonoscopies and other colorectal cancer screening options is, how do I prepare? Do I need to change my diet or my usual medication before I take the test?
For the FIT test, the stool card, there is no preparation. We'll give you the card to take home. You don't have to quit taking any medications. You don't have to change your diet at all. For the colonoscopy, there is some preparation you have to do ahead of the time. Here at Cahaba, you'll meet with one of our endoscopy doctors beforehand that will explain everything, but basically you have to do a prep to empty out your colon. So you have to drink a solution that helps clean out your colon. So when we go in with the camera, we can see all inside your colon.
Thanks, Ashley. So once again, the nurse will explain any preparation that's needed for your test. The colonoscopy has a bit of preparation before you come in for your appointment. We'll make sure it's explained clearly. Very easy to get ready for your appointment. For the FIT test, there's no preparation. Again, that's done every year. So Dr. Bates, our next question is, what is involved in the test? Will it be uncomfortable or painful?
I'm going to try to show a slide here, Danielle. Let's see if this works. Because as I explain this, I want people to kind of have a visual image of what a colonoscopy is. So let's see. So I've mentioned that the colon is your large intestine and it ends in your rectum. The colon is a part of the digestive process and absorbs water and nutrients from the remnants of your food that have come through the stomach and your small intestine. This is what I meant by polyps earlier. They grow into the center of the colon. This is kind of cut away here. You're inside the colon. And so what a colonoscopy is we have a long fiber optic tube, a flexible camera that goes into the rectum. And technically we can drive that tube with some dials and it moves the lighted camera all the way through the colon, going on a polyp hunt. If we find those polyps, we'll also look for ulcers, inflammation, bleeding, polyps, or larger tumors, polyps that have turned into something. But we'll find those polyps and we're able to remove them at that time. So you asked Danielle, was it an uncomfortable procedure? generally, you're going to be asleep for this procedure. There are some exceptions to this, depending on your personal health risk. Again, talk to your physician, talk to your anesthesia physician or nurse about your specific risk. But most of the time that this happens, you're sedated, and you will not be aware of most of what's happening during that test. There will be a nurse dedicated to watching your oxygen level while you're in twilight sleep, and there won't be a lot of discomfort. You will wake up. There may be some gaseous discomfort for the subsequent few minutes, maybe a few hours after that, but it's not invasive in the sense that it's not a surgery.
Yeah, thank you for showing us those images. I think it really helps us to have a better idea of what a test might be like, if there's going to be any pain or discomfort. Again, very minimal risks involved, minimal discomfort involved in the test. And it is so important to be able to prevent colorectal cancer before it's too late. So I just want to remind our viewers, you're welcome to comment your questions in the chat. If you're not sure if we've addressed your question already, just go ahead and send it in the comments below, and we'll make sure to get to it before we end this live stream. For now, Dr. Waits, the next question for our viewers is there any risk involved with either of the tests?
There's no significant risks involved with the FIT test. Remembering that FIT test is where you have a bowel movement in the toilet, and you'll have an extended brush, and you'll just brush that stool, put it on a card, put it in a sealed, clean Ziploc bag, an envelope, and take it in. There's no real risk. The colonoscopy, there are some slight risks because it is a moderately invasive procedure, but most people don't experience any issues during or after the procedure. The risk of either of these tests is that there's a false negative, that you get a false negative result. That can happen, but that's one of the reasons we cycle through these tests again, annually for the FIT test and every 5 to 10 years for a colonoscopy.
Yeah, thanks, Dr. Wade. So just a reminder, here in Alabama, especially if you have a family history, there's a high risk of developing colorectal cancer, but if you get your annual screenings with the FIT test, or every 10 years on average with the colonoscopy, you'll have a much lower risk, and the procedures themselves are very low risk. So really important that we get in for our screenings on time. Ashley, the next question for our viewers is, when will I get the results from my test?
The FIT test usually takes about a week for us to get the results from the lab once they receive the card. So once we mail it into them, we'll have the results in about a week. For the colonoscopy, you will have results immediately from the provider whenever you wake up. The provider will talk with you. If they had to take biopsies of any of the polyps, that generally takes about 2 weeks for those results to come back.
Thanks. So again, it's a pretty quick turnaround time for when you'll get the results back from your test. So not a long waiting time. Again, if you're worried about the time it takes to drive to your local health center and get in for an appointment, we do have the e-visit option. So you'll be able to talk to one of our doctors about what the best screening option is going to be for you. I do want to remind everybody viewing that we will take care of you regardless of your insurance status, and that includes things as important as colorectal cancer screening. So the next question that we have, Dr. Waits, is, does my insurance cover the screening test?
Most insurances do cover a yearly FIT test. Most major insurances like Medicare and private insurances usually cover screening colonoscopies. Mileage may vary, so check your policy, but this is generally true. Alabama Medicaid does cover colonoscopies for symptoms, but at last check, it doesn't cover screening colonoscopies. And then there are numerous facilities around central Alabama that will work with you if you're trying to get colon cancer screening done and you don't have insurance. We're one of those organizations. We will help you get your FIT test every year. Many places will work with you for your colonoscopy, and we're one of those. So we want to help take care of you, and we would love to see the state of Alabama, central Alabama, in this. We've just ended another annual push for colorectal cancer screening month. Was in March. This is something with the 2,500 colorectal cancer cases that were discovered just this past year. We'd love to change the needle on that. Something so preventable as colon cancer, we can really make a difference. So don't let your insurance status or payment be a hindrance. Get in with your local physician or other clinician and talk about colon cancer screening. Danielle, thanks for asking these questions of us and give us a chance to talk about this super important topic.
Yeah, it's my pleasure. We actually have one more question coming in the comments.
Great.
Christina is wondering, how often should the colonoscopy be repeated?
That's a great question. It is the routine answer is every 10 years, or you'll sometimes see it written every 5 to 10 years. That's assuming you're a low risk or you haven't had abnormal pathology, abnormal polyps before. So it's really important, this answer is really important to be talking with your local physician, your primary care physician or nurse practitioner or PA to get your specific answer. But that's the general guidelines, is about every 5 to 10 years for a colonoscopy. If you've had an abnormal polyp, it might be 6 months to 3 years on a repeat.
Yeah, thanks. So definitely talk with your provider about what the best screening option is for you. Just want to recap what we just said. We do have a sliding fee option. Please don't worry if you don't have insurance right now. If you're not sure if your insurance will cover it, we will take care of you here at Cahaba Medical Care. We have 21 health centers across Central Alabama. You can visit cahabamedicalcare.com/locations to find that location closest to you. We also have our e-visit option, so you don't even have to leave your house or your job to talk about colorectal cancer screening with your provider. You can do it today. Just visit cahabamedicalcare.com/e-visit. Thank you so much, Dr. Waits and Ashley, for taking the time to discuss with our viewers their options for colorectal cancer screening. Really appreciate you taking the time to do that. Thank you to our viewers. Make sure we don't have any more comments coming in. So just to recap, if you're joining us now, you can rewind the video and learn what is colorectal cancer. Should I be worried about it? When do I need to get screened? Again, just a quick recap, ages 45 to 75, definitely want to do that colorectal cancer screening. We've got 2 options here at Cahaba. That's the FIT test every year and the colonoscopy generally every 10 years. Again, you're going to want to talk to your provider about what the best options are for you. And also just a quick reminder about our other services at Cahaba. We do primary care for the whole family, all health conditions, all ages, from newborns to grandparents. We also do prenatal care for pregnant moms, expecting moms with delivery at a hospital nearby. We're affordable, we accept all insurances, and we're here to take care of you. We won't turn you away for ability to pay. We'll do everything we can to take care of you. We also offer mental health services like behavioral health counseling, several group counseling services. We like to call ourselves the home for all your healthcare needs, and that's really what we are. So thank you again, Dr. Waits and Ashley, for your time. If anyone does have any further questions after the live stream is over, please visit cahabamedicalcare.com to find that location that's closest to you and give us a call to schedule an appointment. You can also use our e-visit option, as I've mentioned several times. We'd love to see you on our e-visit platform. Super easy, you get to FaceTime with your provider. So thank you for viewing. Please go ahead and leave more comments if you have questions, and we'll get back with you or schedule an appointment with your provider. Everyone have a great day. Bye.